Good morning or good afternoon, everyone. My name is Jennifer Zelmer. I'm the CEO of Healthcare Excellence Canada, and it's my very great pleasure to welcome you to today's webinar and to thank you for joining us to mark the 2021 Canadian Patient Safety Week. I'm joining today from traditional unceded Algonquin territory in the place that we now call Ottawa, and I'm so fortunate to live, work, and play in this very special place. And as I've come to know more about the traditions of this area, I've come to know it as a gathering place, a place for exchanging ideas and knowledge. And so aren't we so fortunate that today in this virtual way, we can continue and build on those traditions. You would have seen the poll questions that have come up to get a sense of who's in the room, but I invite you also to introduce yourself in the chat so that everyone knows who's on the line, and to take a moment now to think about the place where you're joining from and the lands that have been walked by Indigenous peoples since the beginning. We're pleased in today's webinar to offer simultaneous translation. So to hear the voice of our interpreter, go down to the interpretation menu at the bottom of your screen and select the language of your choice. And we also invite you to participate in the chat in either language. Si vous veuillez participer aujourd'hui en français, veuillez sélectionner français du menu au bas de l'écran. And just a quick reminder as well that today's session is being recorded for those who aren't able to join us right at this moment. So we'll be running the recording throughout the webinar today. This is Healthcare Excellence Canada's first Canadian Patient Safety Week, building on the wonderful tradition that the Canadian Patient Safety Institute has established over years. And that's one of the wonderful things about bringing together the Canadian Foundation for Healthcare Improvement and CPSI into our new organization, with really the goal of being able to better match the scale of the solutions we can work on with partners to the scale of challenges that our health systems face. And ultimately, to power more change together with you. And that's really what Canadian Patient Safety Week is all about. It's about shaping the future in quality and safety, including all the dimensions of healthcare excellence. And this year, by focusing on essential care partners in Canadian Patient Safety Week, we aim to ensure that the lived experience of patients, of families, of caregivers, of residents guides Canada's pandemic recovery and resilience across the board. You know, each of us have our own stories, I'm sure. I certainly have examples in my own family of relatives where essential care partners have identified medication errors, they help with physio. They're just the fundamental source of trust and love in what can be very difficult times in engaging with health systems. And we're looking now at the safe presence of family caregivers as essential care partners in health and care settings right across the country, both during COVID-19 and the various stages of the pandemic, and absolutely beyond as well. This week is about broadening awareness and giving us a launching pad so that every week we have the opportunity to commit and to act. And on that note, let's get right into it. And it's my pleasure to turn things over to Carol and Maggie, our hosts for today. So Carol and Maggie, over to you guys.
Thank you so much, Jennifer. I am really excited to be here with you and with this terrific panel today. I can think of no better time than Patient Safety Week to have this discussion about the role of essential care partners in ensuring the safety of Canadians. The tagline for the week is, "Who knows? Essential care partners do." And I know that in our case, as my sister's caregiver, I was the only person who knew her entire health history, who knew her quirks, who knew what was normal for her and what was not normal. When she spent weeks in the ICU, that knowledge and my presence were essential to her well-being. They certainly were not simply nice to have. We've brought together this group of amazing care partners and system leaders for our webinar today, so that, as Jennifer said, we could create a shared space where we can recognize, explore, and be influenced by the realities of those who have experienced illness, from those who provide leadership in the health system, and those who are among the estimated 9 million essential care partners in Canada. Engaging in dialogue like we're doing today, inviting stories and experiences, I think opens up the possibility of truly engaging with other voices so that they can be a part of reshaping our own voice and help us to explore truths that actually may not have occurred to us before. So the purpose today is to have a dialogue with you, not to present to you. So we're going to encourage you to put your questions and comments in the chat so that we can really dig into this important subject. I want to take a moment, though, before we get going, just to acknowledge the toll that it can take on patients and caregivers to share their stories. These narratives are powerful, and they render the teller vulnerable. So to our panelists, we thank you for sharing your experiences and your expertise with us so that we can better understand the truth and so that solutions can be co-designed that will address the root of the issues we face in the system. You know, when I think about the early days of COVID-19, it seems to me that a broad range of healthcare facilities implemented these sweeping blanket visitor restrictions that virtually canceled the ability of essential care partners to be with those they provided care for, and which isolated those caring for people in their homes. As caregivers, we were left unsupported, and we were barred from the bedside in hospitals, congregate care settings, and at home, and homes we were left isolated. And the people that we cared for were put at risk as a result. The impacts of these policies are widespread and they're ongoing. The harm is significant when patients are denied access to their essential care partners and when care partners are left unsupported and without the resources they need at home. As the pandemic has continued on for 2 years now, myths and misinformation have emerged and grown, from things really specific to COVID-19, such as how infectious disease may be transmitted, to the more general, more pervasive myth that essential care partners are nice to have when it's convenient or when there's no crisis. Nothing could be further from the truth. It's conversations like we're having today that will divest individuals and the health system of these myths. The pandemic did not cause people to misunderstand or forget the essential role of caregivers, but it's really important to remember that there's ongoing impact of the pandemic, including the blanket visit policies. That impact is on patients, essential care partners, and the interactions that they have with healthcare professionals. We need to do all we can to support the presence of the essential care partner now and into the future. We need to be certain that in times of crisis or in good times, essential care partners are never shut out again. It's time to co-design solutions and policies that fully value and reintegrate caregivers into their role as essential care partners, regardless of where they provide care. Whether that care is in hospitals and clinics and congregate care settings and long-term care settings, or in homes in our communities. I am so looking forward to the discussion today. So Carol, I'm going to hand it back over to you to get us going.
Thank you so much, Maggie, for that wonderful context setting, and also to you, Jennifer, as we embark on this year's Canadian Patient Safety Week. And as you have both noted, a theme that no doubt resonates with all of us here that are gathered in this session and is particularly salient through this pandemic. So my name is Carol Fancott. I'm Director of Patient Engagement and Partnerships here at Healthcare Excellence Canada, and it is my privilege to be able to co-host this webinar with Maggie, who has been an exceptional caregiver partner with us throughout this work that has focused on essential care partners and the program of Essential Together. So as Maggie alluded to, we have a great panel lined up for today that will bring clarity to the role of essential care partners throughout the journey of care for their loved ones. And an opportunity for us to begin to think about resiliency in the healthcare system and for person and family-centered and partnered practices in care at all times, as Maggie has said, whether in times of calm or crisis. So it's my pleasure to introduce our panel today, and I will begin with Dr. Amit Arya, who is a palliative care physician working in long-term care homes. He's currently the palliative care lead at Kensington Health in Toronto, and earlier this year, he co-founded Doctors for Justice in Long-Term Care, a large coalition of over 1,000 physicians and researchers advocating for an overhaul of the long-term care system in Ontario. Now, Amit has teaching affiliations in medicine at both McMaster University and the University of Toronto, where he was also recently awarded the 2020 Award of Excellence in Social Responsibility. And you may have seen Amit throughout the COVID-19 crisis on many news programs such as CBC's The National, CTV's The Social, and TVO's The Agenda, as he is a sought-after speaker regarding issues pertaining to long-term care. Next, we have Dr. Jennifer Bombosh, who is a caregiver for her 18-year-old daughter who is medically complex and disabled. Jennifer is also a full-time professor, associate professor at UBC in the Department of Nursing, and she holds the CIHR chair in sex and gender science with a focus on the complexities of caregiving in an aging society. And as you can see with these roles together, Jennifer is able to offer unique and critical perspectives on caregiving and the role of caregivers. We also have Linda Moths joining us, and Linda was an essential care partner for her father, Bob Wilson, who experienced a horrific tragedy that made national news in 2019. And as Linda says, with every tragedy, there is always a lesson to be learned and a teachable, positive movement that can come from this. She's been very active, partnering with healthcare organizations to create change, with a goal to foster conversation, raise awareness amongst caregivers, healthcare teams and medical staff, leadership and policymakers to discuss wound care and patient safety standards in Canada, and for all of them to create a united front with and for caregivers to create a united front together with the health professionals, and in essence, what it means to be essential together. Linda is also a member of Patients for Patient Safety Canada. And last but not least, we have Jan Kiefer, who is the Chief Executive Officer and President at Hotel Gia Grace Hospital, or Healthcare in West Windsor, Ontario. And Jan firmly believes that we all have a collective responsibility to each other and to our communities, and as such is rooted in partnership approaches in her work, and work that extends not only in healthcare, but into the social determinants of health. And what grounds Jan in her work and the community are her family, friends, and colleagues who provide her with strength and inspiration. And as Jan tells us, in particular, her grandchildren who are the light of her life. So welcome to all of you. And we're just going to jump right in now. We know that caregivers provide an enormous benefit to the health system, amounting to billions of dollars of unpaid care per year. And the evidence has been clear well before this pandemic hit of the benefits of caregiver presence and the positive impacts that their presence has on the safety, quality, care, and experience of patients, residents, clients, as well as positive impacts for caregivers themselves and providers. So Jennifer, I'm going to start with you. You've been providing care for your medically complex daughter for 18 years. From your perspective, what makes essential care partners vital to the safety and care of their loved ones?
Thank you, Carol, and thank you everyone for having me today. It's a real pleasure to join you from British Columbia. As I was asked to be on this panel and the question that was posed, I really thought and reflected on our experiences across the healthcare system. And I want to bring it back to the person receiving care. And I think part of my role, the most important part, is that I make Eleanor feel safe through my presence. And because she feels safe, she's able to focus on healing and well-being and the things that she enjoys because she knows I'm there. And many of you have talked about stories and the lived experience. So I was going to share one experience that we had several years ago, and I'm sure it will resonate with a lot of people on this webinar. So pre-COVID, we were in the intensive care unit, and Eleanor was admitted. And this is a hospital that has a family-centered care philosophy. And we had been there many times. And as bedtime, nighttime approached, the nurses said to me, well, you'll have to leave now. And I said, what do you mean I have to leave? I always stay. And they said, we have a new policy. No parents can sleep overnight. And I said, well, I don't think that's going to work for us. And I put up a few arguments, but it's nighttime. There's just the nurses and me. And so they were quite firm on their new policy. And I said, okay, well, I'm just going to go over to the parent lounge. And they said, no, go home. We don't need you. You're not necessary. And I said, well, I'm just going to go hang out in the lounge for a little while anyways. Good luck. And I don't think they quite realized what I was saying. But I went to sit in the lounge, and about 15 minutes later, there's a knock on the door, and the nurse came in and said, we need you. And I said, I bet you do. Because what had happened was Eleanor didn't feel safe, and she created complete and utter chaos for their intensive care unit. So I went back and I sat by her bedside, and they gave me a wheelie stool to sit on all night long. And then in the morning, a nurse came, and she went to Eleanor and she said, here's your medications, take them. And Eleanor looked into the little paper cup and she said, no, that's not right. And without even pausing for a moment to think about what the patient had said, the nurse said, take them. This is your medicine. You take this at home all the time. And I could see Eleanor was waffling a little bit, and she looks in the cup again and she's like, no, this is not right. But she's not feeling great because she's in the intensive care unit. And I could see that her surety that this was not correct was breaking down a little bit. So she turned to me on my wobbly stool and said, Mom, what do you think? So I peeked into the paper cup and I said, no, that is not right. And the nurse, this time she paused a little bit because now it's me saying it. And she said, she takes this at home every day. This is the medication. And I said, actually, that's the immediate release version of the medication. And Eleanor takes the sustained release. And if you make her take that, she'll overdose. And the nurse kind of blinked and took a step back. And then she sort of had realization come over her face. And she said, this isn't right, is it? And I said, no, it's not. And so in that near miss situation, there was an error on the part of pharmacy. There was an error on the part of nursing. And I'm really the last line of defense there. And I have no doubt in my mind that if I hadn't been there at the bedside, they would have compelled Eleanor to take that medication. So from my perspective, having spent a lot of time on that side of the bed, there's no doubt that care partners are essential. And what I want to close with is saying, I should not have to scream, cry, cajole, or play nice in order to be present. My presence is essential. It's essential for Eleanor to feel safe. It's essential for Eleanor to be safe, and it should be welcomed. And I'll close with that and hand it back to Carol.
Thank you, Jennifer, for sharing that experience and how you opened so very clearly about how your presence makes your daughter feel safe and how that manifests. And I was thinking about the tagline of a second set of eyes, ears, voice, and hands. And that is exactly what you were and continue to be, that continues to keep your daughter safe. So thank you for sharing that. Janice, I'm going to turn to you now as a CEO of a healthcare organization and hearing Jennifer's comments on this. we know that you were a determined CEO to ensure that care partners remained present through this pandemic. And so if you could offer your reflections on how you see this role of essential care partners within your organization and their connection to safety and quality of care of those that you're serving.
Thank you so much, Carol. And thank you, Jennifer, for sharing your story. I will say that as a nurse for well over 30 years, that story has been replicated, sadly, in many institutions and many care environments over the years that I've been doing what I do. And thankfully, the system is slowly and painfully evolving to a place where we're having this discussion today. Our organization, our hospital, is a post-acute organization, and we're located in West Windsor. And we operate just under 300 beds, and I've been the CEO there for approximately 7 years. I think the pandemic, in many ways at the very beginning, was so incredibly scary for everyone and so incredibly unknown that many of us reacted, pretty much all of the hospitals across the system, at least in Ontario, reacted in a similar fashion. And that was really to put up the walls, lock the doors, and try and control what was perceived to be the uncontrollable at the beginning. And if you go back to January of 2020, we were seeing video footage from Italy and from other countries that was incredibly distressing on multiple levels. And so Hotel Dieu, like many other hospitals and many other care environments, closed the doors to caregivers. It was probably one of the hardest, actually not probably, it was one of the hardest decisions I've ever had to make as a CEO. And I am the CEO, and that was my decision. And the team that I work with at Hotel Dieu Grace Healthcare was left with the responsibility of providing the notification to many of the caregivers that we have in our organization that have been with us for a very long time. As a post-acute organization, we provide complex care. We operate a long-term mechanical vent unit. We have tertiary mental health. And in many cases, the caregivers were at the bedside every day, providing care and support to their loved one. And then one day, our management team had to go to all of those individuals and say, sorry, tomorrow you are not coming in again. So similar to Jennifer's experience, on the other side of it, I've had some of my management team in tears, morally distressed by having to take the actions that we took. And so for us, it was never an easy decision. And it was always a decision that we wanted to reverse as quickly as we possibly could. And so when you talk about why are essential caregivers essential, I think Jennifer's story is a master class in that notion of patient safety and the reason why caregivers should be there. And on the flip side of that, from a staff lens, I think there has been a change. And I think that change is growing in its reach across healthcare systems to a place where staff see family members and caregivers not as a burden and a bother, which is how I think in many ways visitors were conceptualized in the beginning of my time as a nurse, but more as part of the care team. And certainly part of the recipient of care. Our obligation as caregivers to the caregivers is equal as our obligation to the patient. But that is a slow evolutionary change that takes time. It takes multiple conversations. It takes leadership. It takes persistence. And I think in many ways, stories like Jennifer's are the kinds of stories that boards need to continue hearing, that funders need to hear, that CEOs need to hear, because the safety question is on both sides of that. The moral distress for a nurse who makes a mistake, who harms a patient is extraordinary. I have had medication errors in my past, And every single time that I made a mistake as a nurse, every time I've made a mistake as a CEO, it has weighed very heavily on me. And so I think this relationship has to be seen as one that is mutually beneficial and reciprocal, because the safety is on both sides of that equation. It's safety for the patient, but it's also safety for the nurse, for the care environment, for all the patients. And caregivers provide information that we as providers, as nurses, as physicians in the system don't have. Nuances of behavior, nuances of preference, different ways of approach that works for some patients with complex medical needs. We can go on and on, but I think that when I think about this issue, I think about it from within both of those lenses. That's my job as a CEO, is to provide a safe environment for patients and a safe workplace environment. And when we look at the caregiver equation, I look at it from both of those lenses.
Thanks for that, Jan. And I was thinking about your intro and how you embody a partnership approach, and just listening to you now of speaking about we are all in this together, and the creation of safety for all that are involved, and the consideration of how patients and their caregivers are part of the care team, and that it's not just lip service, but that it's an actual philosophy of care that we are embedding and embracing and welcoming, using some of Jennifer's words, essential care partners as part of that team. I'm going to move it over to you, Maggie, for the next set of questions.
Great. Thank you so much. Gee, you know, when I think about the power of stories, it's so true. What matters is in our experiences. So what we're talking about is really at the heart of what we want to explore this morning. The facts about essential caregivers as being key players in ensuring the safety of Canadian patients, regardless of where they're being cared for. So we've talked a little bit about what exactly makes an essential care partner vital to the safety of patients, and why the role of caregivers matter to the well-being of patients. And one of the places that I think we can get tripped up is after recognizing exactly what it is that essential care partners do and why that matters, we have trouble moving to the how. You know, we have to move beyond acknowledging the role to ensuring that care partners are embedded into the care team. So I know you've had some real life experience in finding ways to do this, Linda. And I think it'd be really helpful for our participants to hear from you about how you think essential care partners should be integrated into the care team.
Absolutely. And thank you so much, Maggie. I just want to start off by saying that I'm truly honored to be speaking through this program. It's near and dear to my heart. And I just love meeting everybody that's involved. And, you know, we can do better. I know we can do better. So thank you for allowing me to speak today. So from my experience, some of you may have heard our story. It happened in 2019. Our dad, Bob Wilson, was admitted into the hospital. When we first walked into that big, bright, beautiful facility, we had to navigate around that building and figure out what we needed to do, where we needed to go. The only thing that we knew at that time was our dad needed us. So our dad was admitted into the hospital for 6 long months, and we learned firsthand how to be an integral part of our dad's recovery, his rehabilitation, and his overall well-being. As advocates, we know our loved ones better than anyone else. So as weeks went by with my dad in the hospital, our daily visits became routine, and we got to know the medical teams really well. And we actually had a meeting with them to discuss how can we be a part of your rounds or in the care of our father? How can we participate? How can we be involved? We were very eager as a family to not be in their way, but to really help when they needed. So eventually the teams became really familiar with us. And we actually had to say to the care teams, can we have a meeting with all the potential medical professionals that are working on our dad. That is his primary physician, the charge nurse involved, the RTs, the physiotherapist, anyone who was working on our dad. We thought it was really important that we get together with them and have a meeting and how we can be involved in his care. And that was an initiative brought on by us. I think in the medical field, that's something that a care plan should be discussed week one when a patient is admitted, and how we can become working together. So since our dad was going and staying for a while in the hospital, I always tell families to please make sure to talk to the medical professionals about the care plan and how you can be integrated into that plan. I think that's a very, very key point. I also understand it's not so easy to get that meeting with a lot of these primary care physicians, but as we've known from COVID, it's really made us pivot in a way that, you know what, we can have virtual meetings now. So if we're not always available on rounds, perhaps there's a way that we can meet at the end of the day with the doctor or the care teams to discuss the care plans of our dad. Because not everyone has the luxury of being there all hours of the day. I understand people work full time, but if you can be there after hours and kind of find out what the next steps are, that's essential with learning on what to do and how to care for your dad or for your loved one, sorry. The nurses and the medical teams appreciated that we took the initiative to want to help. And I think that was a key thing too, is just partnering and collaborating together is a key point. What we started to do too, and our tagline is, we are your eyes, ears, voice, and hands. We started to document a lot of our dad's progression. And this really helped a lot of the nurses and the doctors see what we see. So we really did become their eyes. And it was amazing when they would see the video of what our dad could do, because most of the time, some of them would come in for just minutes on the day and they would only see him sleeping. But when we showed him his progress and things that he was doing, it became clear, especially with physio, because they would come in and our dad would be sleeping, but we would show him some of the things that he was doing and they went, oh my God, we need to ramp up physiotherapy for him. So it was really critical to document progress. Also too, as ECPs, in my dad's room, we did a lot of the care, a lot of the things that I would say, eliminate the call button push. And that really does save the nurses time so they could focus on patients that may not have a caregiver by their side. And it really saves them time from going to all these different rooms with a different call button. So we were that call button and we took care of it for them. So I always say, we got you nurses, we got you medical team, the ECPs are here and we're rolling up our sleeves ready to help. When I was caring for our dad, there was a lot of the letter C actually came to mind quite often. And it coincided and defines with how the care teams and caregivers can be essential together. So to really finish off this question, the C's that I wanted to bring up that I think really define the C in ECP is communication. And that is with a care plan and collaboration. Like I said before, I think a meeting involved to communicate and to have full transparency is really important in that meeting. So everything is clear and everybody has a direction of how we can help and what's needed to be done. Another C was champion and compassion. We educated ourselves on our dad's issue, and that further allowed us to really ask questions to the medical teams to educate us and to be better informed on our dad's care. I'm a firm believer that positivity produces productivity. And I think you should encourage not only the medical teams to open up to the caregivers, but also let the patients know that we are here for you, we got you, and we got your back. ECPs, like I said, should document the process and the progress of the patients along. I think that's really, really key when you champion for your patient. And the last C that I bring up is comfort and companionship. I can't imagine my dad pre-COVID being alone and going through what he needed to go through. It's very heartbreaking to hear some of these stories. And, all patients in long-term care centers and hospital deserve the right to have at least one rotating advocate by their side. When I say we, I wasn't the only advocate by my dad's side. I think it's important to have a rotating advocate because, like nurses and medical teams who do shift work, I think advocates also do shift work so they don't burn out, because care really is a full-time job. And I really think it's critical that not only one advocate come in, but have another one come in that are safe to do so. I think that's really important. So within comfort, before leaving the room, does that patient look comfortable? My stepfather was recently in the hospital, and the medical teams would come in and they would do their work, but the mobile table would be on the other side of the room, out of the way, but yet he couldn't reach it. So when I was there, I could move the table back for him, so he had access to all his things, his phone and that. That's another thing that eliminates the call button. So we save them time, we save them money because we're free and we can do a lot of the work. And we also save in future complications or any injuries as well. We can be there for them and we can help them. I think that's what's most important. And all I just want to say is thank you so much from a caregiver's perspective. I'm very passionate about this because we've all learned a lot along the way. I think we can do better and we can be essential together. So thank you everyone for all your contributions and for everything that you do. Thank you.
Thank you so much, Linda. That's really, really good advice. I want to just comment, you have been such a strong voice advocating for the importance of essential care partner presence during COVID-19. And I would love to hear your thoughts on how essential care partners can be integrated into the care team so that they can work together with health professionals like yourself. There was a comment in the chat that I'm hoping you can address it as well, and it's related. It's about the difference between welcoming caregivers into that circle of care and allowing them in. And I wonder if you could just speak to that for us.
Yeah, thanks so much, Maggie. And I just wanted to say that I'm absolutely honored and thrilled to be a part of this panel and really, expressing my gratitude to be here and also learning a lot from, some amazing panelists who have come before me, Linda, Jan, and Jennifer. So thank you so much for your insights. Yeah, so I definitely can say a lot about essential caregivers because they're essential for me to actually do my job as a physician and for my patients to be well looked after in all areas of the healthcare system, whether it's the hospitals, home care, or long-term care, which are the major places that I practice. And I know that, at all times, we see, just as Linda has outlined and Jennifer has talked about, essential caregivers preventing errors in medication and, people coming in, feeding their loved ones, helping them to be repositioned, getting, their loved one up, taking them to the bathroom, advocating when there's changes in signs of health status or their loved one is in pain or not comfortable. And of course, for me as a palliative care physician, that's absolutely vital. Maybe I can talk a little bit about that where, as a palliative care physician, there's a stereotype that I help people to have a good death. And that's definitely a small thing, that's definitely very important in terms of what palliative care does. But more important, which many people are not aware in terms of what I do, is I help people to live a good life prior to the day or that moment when they die. And that's very important. So learning about quality of life is something that I am absolutely dependent on essential care partners so much of the time, because I once again work in long-term care facilities. I see many people who have cognitive impairment. They cannot advocate for themselves. And we've talked about sort of the the importance of essential care partners and talking to the medical team. And I really want to emphasize, why that's important. It's because care is a relationship. And when I'm seeing people who are, new, I'm meeting them for the very first time. My assessments, because I have many other patients to see in the day, are limited in terms of time. So once again, I am dependent on that essential care partner. And I'm sure what I'm saying applies to other health workers like nurses and so on who have other patients to care for. But I'm dependent on the essential care partners to share vital, life-saving information that will prevent my patient from suffering or incurring some undue harm. That's definitely part of my practice. I wanted to add that also in our healthcare system, in order to provide whole person centered care in the context of someone's family, community, and cultural preferences. This is sort of another thing where it's very important to have essential care partners involved. So for example, if I'm assessing someone's pain is obviously something that I look for and assess very closely in the patients that I care for. So when we talk about a holistic approach to this, it's not just about a prescription of some pain relief or opioids, but it may be about a sort of a spiritual sort of aspect to pain and thinking about prayer. It may be about sort of things that, maybe repositioning someone in their bed would help to relieve their pain without any medication at all. It may be sort of that gentle reassurance or, massage and non-prescription related technique, which is important to realizing pain. And of course, when I look after people who have cognitive impairment, they also express their pain in many different ways that actually I don't know, because I'm often meeting them for the first time and my interactions with them are quite limited. I'll add that actually as a physician and as a healthcare system, we actually have a legal and ethical obligation when we proceed with any type of treatment to have goals of care discussions with our patients that we care for. And what that means is that, well, we can propose treatment options, but those treatment options have to be in line with someone's values and their wishes and their expectations for treatment. They have to have, and before that, we have to talk about disease understanding and whether they understand, where they're at in the course of their illness, what are common complications that could happen in the future, and sort of working very closely with essential care partners is a vital part of my practice for all elements of those discussions. And literally those discussions are life-changing. They sort of make a huge difference. Like they're discussions like, well, should I proceed with chemotherapy or not? Should I proceed with dialysis or not? Should I go to a long-term care facility? Should I go back home? What will life look like at home? Do I want to receive resuscitation at end of life or not? And these are those decisions which we kind of work with essential care partners on a regular basis for each one of our patients, actually, to provide safe care. I'll very briefly wrap up and sort of talk about two things which I think are very important to me. I will share that, I think it was an absolute travesty and it was wrong on so many levels what happened during COVID-19. And as has been said by Maggie and many other people, COVID-19 very sadly did not was not the root cause of these inequities, but made them a lot worse and shone a light on this long existing gap in our healthcare system, which definitely has a history in paternalism and patriarchy and does not support essential caregivers, to be honest, although we're trying to shift that. And that's definitely a positive that has come out of COVID-19. I definitely saw in long-term care facilities and many other places the direct harm that came because people stopped eating, their health deteriorated very quickly. Their mental health deteriorated extremely quickly. And I'll never forget that I saw people crying out for their loved ones as they were suffering and dying. And we failed as a system. I think moving ahead, I'll just add that if we want to change public policy, we want to influence governments, we have to recognize the gendered role of caregiving in our society, and we have to incorporate that in government decision-making. For example, I know in long-term care, 80% of unpaid caregivers are women. And that's definitely something we have to look at as to why, sort of the labor of women in our society is thought to be something that is, not respected, not valued. And perhaps it's time, and I wouldn't even say perhaps, I would actually strongly feel that it's time that we actually do assign economic value and we start compensating caregivers for their essential role. If they are essential, it's important that we provide them, a life of dignity and respect. And for me, that does include compensation, because too often I actually see people who have to choose between, well, do I look after my loved one or do I actually go to work and, prevent myself from starving and not being able to pay the rent or the grocery bills? And that's absolutely unacceptable.
Thank you so much. I'm just thinking, I'm an N of one, but this is replicated in millions of households where, my career decisions were motivated by my need to make time to be a caregiver. So moving from full-time work to part-time work was a requirement in order for us to be able to make that balance. So it's just so tremendously important. And I often think about, the inclusion of essential care partners can move us from that paternalistic model of care to a participatory model of care, which is where we really want to be. And I think, as we shift here today, as we think about the benefits on an individual level, you've started us thinking, Ahmed, a little bit about the system. And it occurs to me that as we think about the lessons that we've learned during COVID, we can think about this question as it relates to patients and caregivers and how we can work with healthcare leaders to be a part of transformation of the health system. How can we help to create a system that values and recognizes the role of essential care partners moving forward? I suppose what I'm really asking is, I'd love to get your thoughts on it and Janice's thoughts on how do we crisis-proof policies and practices so that the role of essential caregivers is acknowledged and valued as vital, not just in the sort of relatively easy times, but also in times of crisis. Janice, I'm going to start with you, if you wouldn't mind.
I don't mind at all. Amit, I just want to say how incredibly powerful your words were just now in terms of some of the things that you had to say about that broader system. And I think I'll start with a continuation of your words, which is really one of the crisis-proof pieces for me is advocacy. And advocacy not on the large scale that Amit just spoke to, but in organizations advocacy. So we've developed at Hotel de Grace a culture of voice being recognized and voice of our staff, of our leaders, of our patients and caregivers. And so I think that one of the most important things that we have to do is we have to have an expectation that caregivers have an opinion and have a perspective and have a voice. And that voice has to be cemented in the next piece for me, which is policy. And I know sometimes when I talk about policy, people tend to glaze over a little bit and, think, well, healthcare is already so incredibly bureaucratic, and it is. But policy really does guide many of the decision makings of an organization such as a hospital. And if you think about policies that have enshrined within them that the voice of the caregiver, that access for the caregiver, that the rights of the caregiver are equal to those of the expectations that staff have for protection and voice and perspective, that I think in many ways that for us at Hotel de Grace has been one of the journeys that we've been on. So part of our shift from, the walls up and the doors closed to where we just announced this week a very close return to our previous family presence policy because of vaccination. Part of that has been a journey through risk management and policy. And CEOs and executive leaders are, in many cases across the healthcare system, very risk averse. And so when we think about COVID and what COVID illustrated, it was one very large risk and risk management experience for us all. And if you don't have an organizational policy and an organizational commitment to equality of access and voice for caregivers, it will be very easy for an organization to close those doors again. The next thing I would say is that your staff across the healthcare system have to see caregivers as non-threatening and a benefit. And so there's education that comes with that. There's also a need to ensure that if you're creating, as we have at Hotel Du, a voice for caregivers and a presence for caregivers and decision making for caregivers through patient advisory committees and caregiver councils, that you have to have a similar type of vehicle for staff so that they feel as though they have a voice that is heard by the senior leaders and decision makers as well. That balanced approach is really, I think, in many ways what has helped us at Hotel de Grace. And I think leadership, and I'm not talking about leadership from people like me. I'm talking about leadership at the unit level. I see in the registrations and the folks that are here that quite a few members of my own team at Hotel de Grace are here today, and their leadership has been absolutely instrumental in helping me as the CEO, who has the decision-making authority, to make good decisions. And so in a culture within a healthcare system where leadership exists and is encouraged across an organization, and where perspectives from the front line make their way to the CEO unfiltered and unredacted, that to me is one of the ways in which caregivers and patients begin to have a much more say in what's going to happen to them and how they're going to access the organization. And then I think the last thing I'd say is that there's absolutely no way that any of this is going to change, to Amit's perspective, if there isn't a commitment to do it. In so many ways, it's easy for people like me and others to say, yeah, this is important, and sure, we're going to get to it. We'll get to it someday. And I just had a conversation with the chair of my Patient Family Advisory Council, and I said to her, you have to remember that one of the most important jobs you have is to hold me accountable to do the stuff that need to get done. And that relationship between patients and caregivers and those who are decision makers, and that accountability, holding the feet to the fire and keeping promises, that commitment, I don't know how I can say it any better than to say that it's the easiest thing to do when you have the right relationships and when you have people that are not afraid to call out leadership. But it's really, really easy for leadership to ignore that if the culture doesn't support that. So those are some of my thoughts, and I look forward to Amit's perspective on that too.
Amit, I'd like to welcome you to give your thoughts on that as well, please.
Yeah, so definitely you brought up some great points, Jan, and things that I think about. I think it's very important how you bring up the health worker perspective, and my lens is even a little more narrow than that, focused a little bit more on the physician perspective. And I can tell you that as a physician who's gone through the system, medical learners and residents actually receive very little training on communication skills, how to hold a family meeting, how to have, for example, a goals of care discussion, as we talked about. And really, we're taught, in a disease-focused type of model rather than a person-focused model, a family, focused model. So that's actually a fundamental problem in competencies and training, where we kind of have neglected this, and we don't know how to connect to people, to be very honest. And I think, to be very frank, we can often look to our nursing colleagues for more expertise around that. Another point that I wanted to add, and just sort of sharing some of my personal experiences of what I've occurred through the pandemic is, working in long-term care facilities, as I mentioned, I've seen some of the irreparable harm and suffering that was caused by having people locked out during COVID-19, where people stopped, once again, they actually were malnourished, they were dehydrated, they were left doubly vulnerable because there were neither enough staff to look after residents in long-term care facilities, and they were neither, their essential care partners were also locked out as well, in spite of the fact that they could have been safely allowed in, and the science supported that very early on, but yet the policies did not change until much later. Now, specifically, what I want to mention is that Kensington Health, where I worked, tried their best to get around these directives from the Ministry of Health, from the Ministry of Long-Term Care here in Ontario, as well as Public Health. So actually, earlier on, they had a special program where they actually trained essential care partners to work as paid caregivers in long-term care, and then hired them. so that they could come in and actually look after their loved one and some of their other loved ones with personal care duties. So that was one way they tried their best to get around those harmful directives, which once again shout out Essential Care Partners. Another sort of thing that I saw at Kensington Health is that when we had the vaccination rollout coming out, which of course started in long-term care, prioritized staff in long-term care as well, Essential Care Partners were also prioritized. And there were separate town halls for Essential Care Partners that were led by the medical director and the administration at Kensington Health to address, questions about the vaccine, to try to make sure as many Essential Care Partners as possible were vaccinated as early as possible, to support people with getting the vaccination. So that was actually a top priority for the management. I actually saw, just to add more information about that, is that the medical director actually sent personal letters to Essential Care Partners, spent one-on-one time with Essential Care Partners, answering specific questions in confidence about the COVID-19 vaccine, sort of brought in people who could provide culturally safe and language-specific information just for Essential Care Partners. And that really helped to improve vaccine uptake. And then the other thing that I saw is that as soon as, sort of the weather was better a little bit, with, the springtime, there was a prioritization on outdoor activities where, of course, the risk of spread of COVID-19 is much less, where Essential Care Partners could be present. And, obviously that was a lot better for the quality of life of the residents. So I think, of course, there were creative solutions that were employed at Kensington Health where I worked. But as I've mentioned, we have to look at, why we were in this position in the first place, why our policies did not follow the science, and why we do not recognize that sort of shutting out Essential Care Partners caused so much harm. And moving ahead, how we not just need to have a shift in our, the culture of healthcare, but need to have real policies that will empower those shifts, supported by legislation, enforcement, and funding.
Wow, so much to think about. One of the things about COVID that I reflect on is that it's given us an opportunity for sober second thought, an opportunity for reflection and for leadership to enact change. I cannot believe that an hour has flown by. I'm just in awe. It has been a tremendous hour, so much to talk about. I do want to acknowledge that the questions that have been put in the chat that we didn't get to, we will get to, so you will hear from us. And I'm going to turn it over to Carol with my tremendous thanks to everyone that was on the panel, everyone that's been in the room today. Thank you so much.
Absolutely, Maggie. What a wonderful discussion. And I can't believe an hour has flown by either. And just so much to continue on with. And as you can see in a very full chat box, how engaged the audience has been through this entire panel discussion. So starting with a huge thank you to Amit, Linda, Jennifer, and Janice for really demonstrating the value of the role of Essential Care Partners and really the considerations of what we need to be thinking about in the future. And what it feels like is the future is now. And I think, Jan, you had commented the need for commitment, and Amit, you followed up not only with culture change, but policy change, legislation, funding, accountability that needs to be built in. And so we're going to start with the commitments. And through the Essential Together program and with Canadian Patient Safety Week, really talking about how our healthcare organizations, health and care organizations across this country committing to Essential Care Partners. And we have putting before you this pledge of valuing the role of Essential Care Partners and recognizing how this role is different from visitors, and the commitment that can be shown through a number of actions that work together with patients, families, residents, clients, caregivers, and health system leaders together to develop and implement policies and practices that really reflect person and family-centered care and partnership in care, to be clear, transparent in communication so that people are aware of your commitments and policies that influence Essential Care Partners. And lastly, that organizations that are taking the pledge are real champions of the role and benefits of essential care partners within their own organizations and across the health system. This pandemic has really taught us many, many lessons that we have heard about and talked about, but we know that we can safely welcome essential care partners through times of crisis like now and well into the future. Slide, the learning continues. We offer monthly huddles, national huddles with the Essential Together program. You see the listing of them, the upcoming huddles. The next one is going to be bringing in a bioethicist to talk to us about mandatory vaccines for care partners. And we'll also be talking about engagement capable environments in December. How do we bring patients and caregivers to our decision-making tables? And lastly, stay connected with us through many different formats, through email, through newsletters, and where you can learn about many of our programs and initiatives, including Essential Together. So leaving you today with a huge thank you again to our panelists, to my co-host Maggie, our technical production crew, Kelly, Sheena, and Gina, our interpreters, Carolyn, behind the scenes who make it all happen, and of course to all of you for participating in today's webinar. This concludes today's session. Have a good day.